Hi guys, it is Thursday and the long-awaited Trump Care bill has been put forth for the Senate. They're actually debating about it, talking about it live stream right now on Facebook. And I am feeling a little bit inspired to talk about this topic. Sorry guys, this is probably one of the more political live streams you're going to be getting, one of the more political videos on my part. I try to stay out of the social commentary on what's going on in our nation that is so divided right now, except to at times be giving hope. But the healthcare system is near and dear to my heart, so I thought that I would step up and say something today, and I'm really feeling inspired to. For those of you who don't know my history, before I left my corporate position almost 5 years ago, I worked in healthcare reform. I worked for not-for-profits that were helping change and implement all of those regulations, all of those things that were coming down from the Affordable Care Act put forth by Obama. And we were working to make sure that the doctor's offices, the hospitals, everybody was compliant and get the consumer, those patients, you, me, everybody out there engaged in their health care to be really making this take hold. If any of you know anything about the Affordable Care Act, it was something that it was not meant to happen overnight. The rules, the plan was meant to roll out year after year after year, and that's why we continued to see things changing. I can talk to what was going on 5 years ago. As I said, I left my corporate job, in the not-for-profit world as that grant writer, as that director of consumer engagement, the program manager, 5 years ago. So I don't know where the world has really gone in that time. I've kept up with it a little, but I'm not an expert on it, so I don't want anyone to think I'm claiming to be. But it is something, whereas we're seeing this new bill come forth, we're seeing this new shift in healthcare, there's some things that I want to encourage you all to be considering, talking to your congressmen, your politicians, making sure you're getting answers so that all of a sudden the world we don't have that fear like they did when Obamacare came into action, the Affordable Care Act. There's a lot of people who are scared of it, and there are still people who are scared of it. It's cost our government millions and millions of dollars, and it's because we were coming from a broken system. And while the system is not perfect, I do feel as though there was some effort to try to fix the system. But healthcare ultimately, as the person who comes from the side of consumer engagement, ultimately, remember, your healthcare, where you go is in your hands. It is very much, it falls on your shoulders, and you can make sure, and you have a responsibility to speak up to your congressman, your senator, all of those folks, so that they know what you feel you need, what you feel you want, and you need to let them know. I'm going to give a little bit of a story. I was so frustrated when I was pregnant with my daughter. As you may know, my husband and I, we opted to have a home birth. We didn't want to go to the hospital. I wanted things to be done my way. We found a phenomenal caregiver who was able to help us through this process. Licensed with the state, the whole 9 yards. And we went to our health insurance companies. Some insurance companies will cover this, others won't. Our insurance company she was not a listed provider. So we went and I submitted paperwork and I asked for an exception. It would have cost my insurance company less money to have reimbursed her than it did had I had the birth in a hospital. The hospital birth, from what they were telling me, from their numbers, was going to cost about $8,000 to $10,000. What I paid my provider out of pocket was less than that. significantly less than that. And she is licensed with the state. She is licensed across the board. Things in that healthcare system, when I looked at all of it, the limited amount of research that's been done on it showed that it was accomplishing what in healthcare they call the triple aim. This is what the Obamacare wants people to be encouraging. They want better health outcomes. Makes sense. We don't want people dying on us. We want people to get healthy. We want there to be more efficient things. They want better, lower costs. Again, makes sense. We don't want to be spending through the nose for treatments that aren't really helping. And they want an increased patient experience. The home birth from all the studies that were done demonstrated that that was going to be happening. But the insurance company decided not to. This is with me spending upwards of almost 10 grand on my insurance that year. And then I had the out-of-pocket expense. They would have spent what I gave to them, what I paid, would have covered. It is it's ridiculous. They still would have had some. And as we're looking at this, it is something where you as a consumer need to know what you want to do for yourself, what's right for you. And I'm sorry I got off tangent. Healthcare is something that's really important to me. And I knew that for myself, and I was able to have the money put aside to be able to do what I wanted. I know that not everybody's in that position. Not everybody is able to be spending that money. Not everybody has that affordability and that ability to do that. But at the same time, consumers should have the choice, especially when it is something that we all do need to be. We need to know what we want. And our healthcare system does benefit the top of the ladder. It is a tough system. And when I know that when I was in the healthcare system working on it, the big thing was they wanted everybody to have equal. They wanted it to not matter if you were making $1 million, if you're making less than that. For those of us, people who weren't like me, who was in the position to be able to afford both the healthcare, having the coverage, God forbid something awful happened, having that coverage, but also being able to go outside of the system, there wasn't that ability to do that. Like, many people don't have that ability. I'm very fortunate. And you look at some of these things when we're looking at healthcare, how much of our own spirituality, our own personal growth is out of alignment and out of whack because this is what the system says to do, but this is where we're at. And how much different could it be? And I do feel as though this conversation is not just about what the system is, but it really has to be as the patients. What can those providers do for us as patients? What can they do, and how can we be engaged in our health care, pushing to make sure that we are getting what we want. We are living our life to the fullest. And it does also I recognize that there's a lot of personal responsibility and accountability that goes along with this. Because as a patient, we have to do what is not only what we're being told. There isn't magic pills. There's not things that are going to make us healthy. There's not things that are going to fix everything. Any pill we take is likely going to have some type of side effect. And I do think that we have to recognize that. So it's not like we're going to be able to take a pill and lose a bunch of weight, or we're going to have a pill and all of a sudden be healthy. We do have to recognize that there's that personal responsibility, but I do feel as though that conversation needs to happen. We need to become responsible. The system needs to be responsible and be willing to work with patients and be willing to help those folks who they don't feel like so that they can access their health care, so they're not waiting till the last minute. Health insurance needs to be affordable for not just the upper tiers. It needs to be affordable for everybody. I can tell you, as I've mentioned, I'm spending thousands of dollars every single year on health insurance. And I'm still having to pay for things out of pocket because it's not covered by what the system is. It is crippling at times. And I do feel as though if I'm experiencing it and I am in a fortunate position, I can't imagine how everybody else, how people who are our vast majority of our population who isn't, and those people who aren't as lucky as I am, how they're doing it. And I can tell you I am passionate about this because I will probably be one of those individuals who, if the system changes, I may be without health insurance. I go through the exchange for myself, my husband, my daughter. It's the easiest system for us, and I know that I can go through a Chamber of Commerce, join the Chamber of Commerce, pay those, and then get insurance through there. But as a small business owner, it's different, and it's hard. I don't have an employer for myself or my husband who can cover that. We are looking outside of that system, and it's hard. So I do want to encourage each and every one of you, look at what is important. Talk to your congressman, become informed, and I will be one to admit I know that Obamacare, the Affordable Care Act, was not perfect. I don't know enough about Trump Care and the American Health Care, AHCA, sorry, again, 5 years outside of the business. I'm not as on top of the lingo as I used to be, but it is something that I do want to encourage you to talk to your congressmen, your senators, get engaged in the conversation. The consumer's voice, the patient's voice, your voice is so important. And again, I know I mentioned that with your congressmen, your senators, but it's just as important with your doctor. Because your doctor, our healthcare provider, because there are a lot of mid-levels who do a lot of the doctor's work, the physician's assistants, the nurse practitioners, even when you start getting into the nurses, talking to all of those care providers, because they probably have a lot of tips for you and know things that are workarounds and ways that you can get things utilized for yourself. I know that every single time that we've talked to our providers, they'll say, well, you can do this, but if that doesn't work for you, there's these other options. And it's having that educated conversation. Beware of Google, I should say. Again, coming from healthcare, don't self-diagnose, but have the conversation, because the doctors are the experts, or as expert as we can be in health. And your health is what allows your spirituality, your physical existence, to be able to get the most out of it. It's important to remember that we, again, are physical beings, but spiritual souls having that physical existence. And we want to make the most out of our bodies, get the most out of our environment. And our bodies are our temples. More than the roof over our head, the food in our belly, we need to make sure our bodies are the best they can be. And by ensuring that the healthcare system, it's one small part to the big whole, but it's an important start to it. And knowing that the bill just came out to the Senate, and it's important that we all act quickly so that we don't get trapped in a system that is hard to break and is hard to move away from. We've already been in a system that isn't always working for everybody. And I'm sorry for the little bit of a political rampage, a little bit less about spirituality today, but a lot about things that are important to us. And I'm sorry that I've rambled, and it's incredibly, incredibly important to me. I'm where I am today because the healthcare system worked for me. From when I was in an accident more than 15 years ago, and I had my mother as my advocate fighting every single step of the way. The healthcare system was broken for me. I was hit by 3 semis. My car was crushed, and the ER sent me home the same day. They call it the death center in the town that I went to. This was the same place where I went in with a half an inch kidney stone. My kidneys were shutting down, and they sent me home telling me I was constipated. It's one of those things where there's bad health care out there and the system is broken. But when you get good health care and you fight for it and the system works, it works wonders. I had amazing rehab specialists, from my speech pathologist, my occupational therapist, my physical therapist, my vision therapy, everything that really helped me get on my path. And they've been good there's been wonderful. I spoke about my daughter's birth. I cannot express enough. I had no complications whatsoever. The horror stories I heard from other individuals about the damage that was done to their body through it, I didn't experience because I listened to my body. So I listened, and I had tremendous healthcare providers who were there with me. And I know that it's hard to access those. Some of these good providers, because of the way the system is built, those who can't afford don't get to see them, don't even know where to look. And don't know and have a hard time accessing that. It's important, though, that you push, you be educated, you be the consumer. You've only got the one body until something changes, and who knows, someday we might have other things. We might be able to have all sorts of artificial limbs, be artificial intelligence, and the brain is the only thing that's there. But until that day comes, this is our body and what we have to live with. So it's important that you get the most out of it, and that we're not in a system that is broken. If other countries, the majority of other countries can do it and it works for them, I'm sure the United States can make it work for us. I mean, we are one of the few populations, one of the very few, I think we're the in the world that is not socialist. When it's not socialist, there's the barter system, where everybody has their role. There's a couple countries that do a employer-based system, but the employers control the costs. And even when you're not an employee, they still control the costs. We're the only one. There's a dual system where we have the socialist and the capitalist, which means the insurance companies are really, even though they have a lot of the insurance companies, I've worked with some of the great ones in Western New York, and with great people who really do want to make sure that insurance and healthcare is affordable, that people are getting the healthcare that they need, that the conditions are managed, and that people are as healthy as they can be. But at the end of the day, they have a bottom line. So again, I have rambled, and you're probably sick of hearing from me. Call your congressman, call your senator, read up on what you know, because you do have a voice. Call your insurance company and let them know what you think. Call your providers, anybody you can make a call to, you can talk to. Be the squeaky wheel. The more squeaky wheels there are, the more likely it is we're going to see positive change for ourselves. That's it for today, and I will be talking to you again soon.